Good evening, everyone. I hope you can hear me very much well.
We can hear you.
All right. So good evening. I'm kind of delighted to be here in our midst today, and I hope the topic of our lecture will be something worthwhile to hear. And we're talking about something new as far as Nigeria is concerned. And I hope we all mobile technology enabled antimicrobial stewardship program. I'm trying to share my screen now. So now while Dr. Bello is trying to share the video, so it's gonna be a very practical and of course somehow theoretical session as far as the mobile tech program is concerned. The video is just to give us a brief outlook of what a mobile app program entails for antimicrobial stewardship in a health facility. Then I'll be running us through this
According
has
to
been
the World Health
implemented.
Organization, antimicrobial resistance currently results in over 700,000 deaths globally. This figure is projected to reach 10 million by 2050, with higher prevalence in developing countries including Nigeria. To stem this tide and to promote rational drug selection, MicrobicPro was developed. The app has several helpful features, including aware model color code categorization of medicines, organized stewardship priorities, antibiograms from different locations to guide empirical choice, evidence-based rapid selection to the employee's algorithm structure to rank antibiotics for different clinical sample. Healthcare providers using the app have reported increased outcome of successful therapy for infections, decreased antimicrobial consumption, cost savings for the health facility and patients, increased awareness, adoption, and practice of antimicrobial stewardship. More importantly, the app can be customized to meet your institutional or hospital-specific stewardship needs. You can download MicrobicPro on Google Play Store for more information or contact us on www.microbicpro.com or email microbicpro@gmail.com.
Now, we'll be talking about a mobile tech-enabled antimicrobial stewardship program, the pros and cons. We'll be looking at it. Well, I'll be giving us a background on why do we even need it in our antimicrobial stewardship program? Why is antimicrobial stewardship program even important for a health facility or an institution in the country? Now, in order to give a background to all that, I must let us know that infectious diseases is one of the greatest burden in the developing world. Globally, infections have caused over 670 million in daily adjusted life years in terms of burden. However, a huge burden of huge share of this burden come from African countries, of which Nigeria accounts for a even larger share. Now, according to the Nigerian Center for Disease Control, infections, including communicable ones, have accounted for over 66% of mortality in the country. And amongst these, the leading ones are the all rank among the top 10 leading cause of death in the country. Now, more is now being complicated by antimicrobial resistance.
Hello, is the network? Wow. We lost him due to network. Can we wait for him a while? Okay. He's back.
trying to share my screen.
Okay.
Okay. So we said more specifically, the treatment of infections is now complicated by antimicrobial resistance. Um, I don't know why it isn't
What's the
moving.
problem? Ayobami?
I think I'm having issues trailing it down. I'm coming. Okay.
Okay.
Yeah.
Is it going now?
Okay. Yeah, it's good. Thank you very much. So more specifically, the treatment of infections is being complicated by antimicrobial resistance, and it is estimated that among the recommendations in the Nigerian guideline, there has been development of resistance to almost all of these disease classes, while globally, antimicrobial resistance has caused 700,000 deaths. Even as of 2017, we can see from the video. However, it is projected in the least estimate that by 2050, we'll have at least 10 million lives being lost per year, total deaths resulting from malaria, HIV, and tuberculosis combined. Now, in order to stem this tide, and knowing the fact that a higher potential for AMR exists in Nigeria, we need a measure called antimicrobial stewardship. But first of all, what are the drivers of antimicrobial resistance in Nigeria? You would all agree with antibiotics. Antibiotics are being used without prescription, multiple prescription of broad spectrum antibiotics, and a more unique problem, that's the proliferation of fake and substandard drugs. To compound it, we currently have in almost all health facilities in Nigeria, there is almost little presence of antimicrobial stewardship programs. In a WHO survey of 12 countries, Nigeria has the highest average prescription of antibiotic drugs per encounter. Now, if 3.8 drugs were prescribed per patient encounter, according to the people interviewed, however, almost 48% of all these prescriptions have an antibiotic component, which confirms what we said earlier. That's indiscriminate large use of antibiotic prescriptions. And more importantly, these antibiotics are even available in patent medicine stores and in pharmacies, and they don't require a drug prescription before they even give you antibiotics. So it suggests we really have a big issue as far as antimicrobial consumption, antimicrobial resistance are concerned. Now, among the solution measures, before we dive in further, I would like to define stewardship. Now, to a layman, of course, you say stewardship is a careful and responsible management of something entrusted in your care. Now, trying to bring that down to antimicrobials, that it's a kind of coherent set of actions which promotes and ensures the responsible use of antimicrobial drugs. Now, according to the World Health Organization, we could define an antimicrobial stewardship program as an organization or system-wide healthcare strategy that promotes the use of antimicrobials. Now, in order to let us in more on the advantages of stewardship. What are the advantages stewardship actually delivers to an healthcare institution? Those are rewards in general. Implementing an antimicrobial stewardship program in an institution first helps optimize the use of antimicrobials. Or in a stewardship program, antimicrobials are classified based on whether they are assess, watch, and reserve based on the need to use them based on the treatment guidelines. So you are able to optimize their use it promotes a behavior change in the towards more rational use of medicines. It helps the National Action Plan for Nigeria. There's a National Action Plan um, that has a 5-point agenda in Nigeria, which of which antimicrobial stewardship happens to be one of them. The National Action Plan hopes to increase awareness and knowledge of AMR related subjects to build one health AMR surveillance system. But more importantly, it also hopes to promote regional access to antibiotics and antimicrobial stewardship. And there's no way we talk about stewardship without mentioning this World Health Organization aware model classification, where antibiotics are grouped into 3 classes. We have the access, we have the watch, we have the reserve. The access antibiotics, the antibiotics is lower resistance potential, and they are recommended for first line therapy of most infections. The watch, the antibiotics, when you can't find an effective reserve, but they should be optimized and should be targets of stewardship program, while the reserve antibiotics are specifically reserved for multi-drug resistant infections. In an antibiotic stewardship program, you get to talk about um, the outcome indicators for which we're talking about antimicrobial consumption, which can be measured through the point prevalence survey, the daily divine dose, and secondary outcomes in terms of patient clinical outcomes, as well as the microbiological outcomes. Probably there was increase in susceptibility when the studies were done. So I would like to let us know that antimicrobial stewardship programs is new in Nigeria. Just 13.5% of tertiary health centers have it, according to one study, while just 4 out of 17 hospitals have treatment guidelines based on local resistance patterns. So now, mobile app. I know some questions might be on our minds that, okay, why should we actually use mobile app? Because in this mobile age, at this mobile hour we are, through this mobile device we are communicating, then it is, I think that answers the question in terms of why should mobile app be used in antimicrobial stewardship. But to expatiate further, currently the mobile penetration in Nigeria is over 99.6. And in terms of mobile penetration, the health sector is not left out. In some studies in the country, between 70 and 90% of healthcare providers, doctors, in many cases, are willing to use anti-mobile health apps to guide the diagnostic process for diseases. So concept of MicrobicPro also as my company to promote mobile application in the use of antimicrobial stewardship. And there has been several studies in terms of effectiveness of stewardship programs. A study done in Brazil, an observational, analytical, and longitudinal study showed that when a mobile app program was implemented between December 2014 and 2015, these are the mobile interventions done, treatment manual, local antibiograms, and were made available to clinicians on their mobile phones. The impact is almost 296,000, almost 300,000 US dollars. There was increase in consumption of access antibiotics, which is good. There was decrease in consumption of reserve and watch antibiotics, which is good for an antimicrobial stewardship program. And they were able to implement this with little cost and a seamless improvement in terms of sensitivity of the antibiotics over time. Now, there was another study done at the University of Iowa. They are yet to come up with their final result in terms of the impact, but early results suggest it is helping them to actually lower the consumption of watch antibiotics. So now, the importance of a mobile app, like I said, cannot be overemphasized. It makes the content, the antimicrobial stewardship content, available to a wide scope of audience. There's ease of use by users, and it makes outcome evaluation very easy and seamless. And there could be expansion of content improvements almost instantly as far as the healthcare institution is concerned. However, of course, there's nothing without an advantage that doesn't have its own disadvantages. So while mobile health app, it's currently what the world is deviating to in terms of mobile technology and technology in general. And antimicrobial stewardship is not left out, but we need to know that, okay, not every clinician have mobile phones, but in terms of, and then there's a novelty syndrome that, okay, this thing is new. Should we accept it? Is it going to work? But over time, we believe when things like this are being get used to in the country, it will help improve stewardship. And as pharmacists, we are not left out in terms of promoting antimicrobial stewardship. There are several things we can do, from raising awareness to disseminating protocols and monitoring consumption. These are the processes in the stewardship program, and antimicrobial and the mobile app will only help enhance these processes. I hope I've not exceeded much of our time, sir. So I think
You have 2 more
we
minutes to
can
go.
stop here. Okay, I have 2 more minutes. So with the 2 more minutes,
Just to
let me expatiate more on our role. Let me expatiate more on the kind of interventions we can do. Um, so now I want to talk about the state. I've talked about the status of antimicrobial stewardship in Nigeria. Now, in terms of antimicrobial stewardship in Nigeria, I said just 4 out of 17 hospitals that have stewardship program actually implement standard treatment guidelines and the care models by home run Lagos. We are familiar with the mobile authorization service, which has been used for a while of knowing what NAFDAC, whether the drug has NAFDAC number. We can say that starting, I think I'll just conclude. Sorry
okay, don't
about
worry.
the
And let us
network.
stop here. Thank you so much, Dr. Pharmacist Diyaolu.